and welcome to another episode of OB-GYN On Call. If you're new here, I'm Dr. Isa, your OBGYN on call, and this series aims to make sexual wellness topics accessible for everyone. In honor of World AIDS Day, which happened a few weeks ago, this episode will focus on HIV and AIDS, specifically the misconceptions surrounding them. HIV is a major global health issue. It already claimed approximately 42.3 million lives to date, and around 39.9 million people are living with it. Alarmingly, the Philippines has the fastest growing HIV epidemic in the Western Pacific. Daily cases in the Philippines has increased 411% from 2012 to 2023. And according to the Philippines Department of Health, or DOH, the number of people living with HIV is projected to reach 215,400 by the end of 2024. These numbers highlight the urgent need to debunk myths and raise awareness about HIV. Let's start by understanding what HIV and AIDS are. These terms are often used interchangeably, but they actually have distinct definitions. HIV stands for Human Immunodeficiency Virus. It is a virus that weakens the immune system, specifically targeting CD4 cells or helper T cells. These cells play a crucial role in fighting infections. HIV can be transmitted through the following: unprotected sexual contact, sharing needles, sharing other drug injection equipment, and from parent to child during pregnancy, childbirth, or breastfeeding. HIV progresses through these stages. Stage number 1 is acute HIV infection. This occurs about a month or two after contracting the virus. People living with HIV typically have flu-like symptoms which subside after a few weeks. Stage 2 is chronic stage, or the clinical latency stage. During this period, a person living with HIV may feel healthy and often show no symptoms. However, if they don't get tested and treated, they may unknowingly spread the virus through unprotected sex and other means. Without proper care, the virus will continue progressing and it will lead to the third and final stage. Stage 3 is AIDS, or the acquired immunodeficiency syndrome. This is the final and most serious stage of an HIV infection. An HIV-positive individual at this stage may experience the following symptoms: fever, swollen lymph nodes, fatigue, sudden weight loss, diarrhea, oral yeast infection or thrush, shingles or herpes zoster infection, and atypical pneumonia. At this point, the immune system is now severely damaged. This leaves a person living with HIV vulnerable to infections that they typically wouldn't get if they had a healthy immune system. These are known as opportunistic infections or opportunistic cancers. Some examples include herpes simplex ulcers, invasive cervical cancer, recurrent pneumonia, or primary lymphoma of the brain. Without treatment, a person in this stage has a life expectancy of about 3 years, but this could be cut short if they end up getting a dangerous opportunistic illness. Despite the efforts of sexual wellness educators and non-government organizations to raise awareness about HIV, stigma still surrounds it. This often discourages people from learning about the condition or taking important steps such as regular HIV testing. Years of misinformation have fueled myths and misconceptions about HIV, many of which are still widely believed today. With that in mind, let's debunk these myths and uncover the facts. Myth number 1. HIV will always lead to AIDS. It's a death sentence. A 2021 study revealed that one of the main reasons why people hesitate to get tested for HIV is the fear of receiving a positive result. Many believe that receiving a positive result means that their life is essentially over. This notion is completely false. Thanks to antiretroviral therapy, or ART, people living with HIV can now live a normal lifespan and avoid progressing to AIDS. ART involves taking a combination of HIV medications, which prevents the virus from multiplying and helping the immune system to recover by producing more CD4 cells. As a result, even though HIV remains in the body, the immune system is strong enough to fight off infections and prevent opportunistic infections. In fact, with consistent medication and early treatment, an HIV-positive person can achieve an undetectable viral load. This means that the amount of HIV in the blood is so low that it can't be detected by a viral load test. As long as a person maintains an undetectable viral load, they can have unprotected sex with their HIV-negative partners without transmitting the virus. Please note that the antiretroviral therapy is not a cure for HIV, but a way to manage it. Now, some of you may be concerned about the financial implications of managing HIV. You might be wondering about the cost of medications and other related healthcare services. However, it's good to know that PhilHealth provides an outpatient HIV/AIDS treatment package. This package offers annual reimbursements of up to 30,000 pesos. Additionally, organizations like Love Yourself Incorporated offer support and services to help with treatment. So if you've had unprotected sex, whether with a casual or with a long-term partner, and you haven't gotten tested for HIV yet, consider this your sign to do so. Getting tested not only provides clarity on your sexual health, but if HIV is detected early, you'll be increasing your chances of achieving an undetectable viral load. Myth number 2. HIV has obvious symptoms. Another misconception is that you can tell if someone has HIV or AIDS based on their appearance. Some people believe that those with HIV are often underweight, have pale skin, always coughing, or they just generally seem unwell. While symptoms like fever or fatigue do occur in people living with HIV, they don't look significantly different from people who are HIV negative. This myth isn't just applied to others. Some people use it to check on themselves. They avoid getting tested because they think they feel fine. However, initial symptoms of HIV may be similar to the common flu. After that stage, you might continue living a healthy life without realizing that you have the virus. And if you do end up getting worse symptoms, it might all be too late, so it's best to get tested now. Myth 3. You can detect HIV just a few days after exposure. You can't just walk into a testing center the day after having unprotected sex and expect accurate results. When getting tested, make sure that you do so at the right time after having unprotected sex. There's a window period for HIV testing. Love Yourself Incorporated, an HIV advocacy group which offers free testing here in the Philippines, recommends that you get tested 3 months after exposure or unprotected sex. This may provide you with a more accurate result. However, during this period, it's best to avoid unprotected sex. But if you have unprotected sex with another person during that time period, then it's best to get tested again 3 months after that encounter. Myth 4. Only same-sex couples can get HIV. Another common myth surrounding HIV is that only same-sex couples, particularly gay couples, can contract the virus. This stigma comes from the fact that the AIDS epidemic in the 1980s primarily affected gay men, and current statistics show that the highest number of HIV cases are among men who have sex with men. Because of this, some straight people think that they don't need to get tested just because they're straight. But that's not true. People of all genders can contract HIV. Myth number 5. HIV can be spread through touch. In the mid-80s, there was a widespread myth that HIV can be transmitted through touch. However, as awareness grew, this misconception was debunked, thanks to efforts from influential figures like Princess Diana, who played a significant role in changing public perception. During a visit to the UK's first purpose-built HIV/AIDS unit in the London Middlesex Hospital, Princess Diana shook hands with an HIV-positive individual, demonstrating that HIV isn't transmitted through casual contact. However, there are still some people who believe that HIV can be transmitted through touch, and this is completely false. HIV is only transmitted through exposure to certain bodily fluids such as blood, semen, pre-cum, breast milk, rectal fluids, and vaginal discharge. These fluids must come in contact with another person's mucous membranes to transmit the virus. So if an HIV-positive individual has blood or semen on their hands and they accidentally hold another person's hand, the virus cannot be transmitted. Myth 6. Insects can carry and transmit HIV. Since HIV can be transmitted through injected needles, some people wonder if insects like mosquitoes can transmit the virus. The answer is no. Mosquitoes cannot inject HIV-positive blood. There are a few reasons for this. First, mosquitoes have a unique two-way blood-sucking mechanism. This way, only saliva is injected to humans when they bite. Second, HIV is broken down inside the mosquito's body, making it impossible for the insect to transmit the virus. Myth 7. You can never get HIV from oral sex. While the risk is much lower compared to vaginal or anal sex, it's still possible to contract HIV through oral sex, especially if you are performing oral on an HIV-positive individual. If you have small cuts or sores in your mouth, then the HIV in the semen or the vaginal fluids can enter through those. To minimize risk, check for sores or any gum bleeding before engaging in oral sex. You can also avoid brushing your teeth to avoid any irritation, or consider using a condom or dental dams when performing oral sex. Myth 8. HIV-positive people can safely have children. A common myth about HIV-positive individuals is that they'll automatically transmit the virus to their children if they get pregnant. This isn't true. People with an undetectable viral load can safely have children, with the risk of transmission being as low as 0.1%. Depending on your viral load, an obstetrician-gynecologist specializing in infectious diseases can advise you to take medications that are safe in pregnancy. Also, depending on your viral load, your OB/GYN might advise you regarding mode of delivery. Some HIV-positive individuals may deliver safely through vaginal delivery, while some may need to go a cesarean section or a C-section to reduce the risk of transmission. A C-section delivery can reduce the risk of transmission, so only around 0.3% of those individuals who are HIV positive will transmit the virus to their babies. Myth 9. If both partners are HIV positive, they can have unprotected sex. People who are consistent with taking antiretroviral therapy that reduces the virus to an undetectable level in their blood cannot transmit the virus during sex. This is known as undetectable equals untransmittable, or U equals U. However, the Centers for Disease Control and Prevention still recommends that couples living with HIV still use condoms during sex. This is because in rare cases, a partner may contract a different strain of HIV or may contract a superinfection, which is a strain that is resistant to the current ART medications. The CDC states that the risk of this happening is between 1 to 4%. Myth 10. Being on birth control reduces your risk for HIV. Hormonal birth control methods such as the birth control pills, injectables, implants, and even the IUD cannot prevent the transmission of HIV or other STIs or sexually transmitted infections. The only contraceptive that can protect you from both pregnancy, HIV, and other STDs or sexually transmitted infections are condoms or barrier methods. Even with modern treatments that help HIV-positive individuals live as normally as possible, having the virus can still lead to serious complications. That's why it's so important to continue practicing safe sex guidelines to protect yourself and your partners. Here are some key practices. Use condoms and other barrier methods during sex. As mentioned earlier, the most effective way to prevent HIV transmission is by using barrier methods of contraception like condoms. Condoms create a physical barrier that prevents the exchange of bodily fluids during sex. For oral sex, especially when performing oral to a female partner or cunnilingus, then you can use dental dams. Dental dams act as a thin barrier between your mouth and your partner's genitals. For activities like fisting, wherein the hand is fully inserted into the anus, wearing gloves is highly recommended to minimize the risk of cuts or abrasions that could lead to transmission. Similarly, finger cuts, which are like mini condoms for your finger, are useful for prostate or vaginal stimulation. Lastly, always pair these methods with a water-based or silicone-based lubricant. Lubricants reduce friction during sex, preventing the condom or barrier method from tearing. Tearing of these barrier methods can increase the risk of exposure to bodily fluids. Take PrEP to reduce the risk of HIV. PrEP or pre-exposure prophylaxis is a highly effective way to reduce your risk of contracting HIV. There are two main approaches to taking this medication. This depends on your needs or your lifestyle. Daily PrEP. Take a pill daily with or after meals. This method maintains a consistent protected drug level in your vaginal and anal tissues, ensuring 24/7 protection. This is ideal for individuals without a set schedule or for those who want continuous protection. When starting daily PrEP, abstain from sex for 7 days to allow the medication to reach full effectiveness. If you might have sex during this period, then take 2 tablets 2 hours before. Then you can continue taking 1 tablet daily at the same time. If you miss a dose, then take it within 12 hours of your usual time. If more than 12 hours have passed, skip the missed dose and then continue with the next pill as scheduled. Taking PrEP at least 6 days a week can provide adequate protection for vaginal or frontal sex, so missing one dose occasionally won't compromise your protection. However, missing more than one dose weekly can significantly reduce the effectiveness of PrEP. Event-based dosing or PrEP on demand. Another option for taking PrEP is event-based dosing or on-demand PrEP. This method involves taking the medication only before planned sexual activity rather than daily. However, this approach is only effective for anal sex because PrEP doesn't reach the protective levels in vaginal tissues as quickly as it does in rectal tissues. Here's how event-based dosing works. Before sex, take 2 PrEP tablets 2 to 24 hours before engaging in anal intercourse. Then after sex, take 1 tablet exactly 24 hours after your first dose. And for the final dose, take 1 tablet of PrEP 24 hours after your second dose. Use PEP or post-exposure prophylaxis after high-risk unprotected sex. If you have unprotected sex with someone new or someone who is considered high risk, take PEP or post-exposure prophylaxis within 72 hours of potential exposure. Keep in mind that PEP is for emergencies only and should not replace regular preventive measures like condoms and PrEP. Consider you and your new partner getting tested for STIs before engaging in sex. Whether you're starting to get intimate in a serious relationship or exploring a casual arrangement, it's a good idea to talk about your sexual histories, or better yet, get tested for STIs before engaging in sex. Testing is the most reliable way to know each other's status, fostering trust and safety. If any sexually transmitted infections are detected, you or your partner can address them promptly with the proper treatment. This will ensure peace of mind for both of you. Avoid sharing needles. Please avoid situations where you might end up sharing needles without the proper sterilization, like illegal drug use. Not only does this increase your risk of contracting HIV, but it's also illegal. This can have long-term harmful effects on both your life and the life of those around you. Stay safe, make healthy choices, and prioritize your well-being. And that ends our HIV/AIDS guide. I know that this is a serious topic, but it's incredibly important to discuss. With the numbers rising both here and around the world, spreading awareness about HIV and AIDS is something that we all need to do. If you found this video helpful, then please like and subscribe. Your support helps us to reach more people and share these insights with people who need them the most. Once again, I'm Dr. Isa, your OB-GYN on call. Thanks for watching, and I'll catch you in the next episode. Bye!